So is Arizona even prepared for what's next? Of course, this last weekend was the first test to see if people out there were really social distancing, really following the guidelines out there on their own. Maybe you observed some of it. We did see packed restaurants and businesses with fewer people wearing masks. So now we wait and see if our state's reopening leads to a new surge in cases. ABC 15's Nicole Grigg with what types of concerns those on the front lines have as we wait for this health experiment to play out in real time.
The governor has said our hospitals have capacity and that we're prepared. He also has said that Arizona will continue to focus on slowing the spread of the virus. Our state's number of COVID-19 hospitalizations still going up, and we have reopened most businesses. Everything from restaurants, bars, malls, casinos, even entertaining crowds. This past weekend was the first test to see if people would social distance without a state mandate.
For me in the health field, it's unfortunate to see people not practicing social distancing and not wearing masks.
We know hospitals like Valleywise, where Dr. Lavecchio works in the ER, has increased hospital capacity.
As far as our preparation goes, no one knows the exact number, but many of the beds that were empty are going to be taken up by people with traditional medical complaints, surgical complaints, and elective surgeries. So that'll limit the amount of potential COVID-19 patients that we could care for. One thing to think about is we're starting to open up social distancing, but we might have to pull it back if things get a little hectic.
Maricopa County says they're still planning for increases in hospitalizations, but will we have enough capacity? The governor says yes. Another thing to consider moving forward, rapid testing inside hospitals.
Ideally, we would have a rapid test that's reliable that we could do on you, and it'll tell you that you don't have it. This way we could put you in one part of the hospital.
And if there's a surge in cases, what's the plan to bring more doctors and nurses in?
I think the other thing to remember too is that we, as healthcare providers, do get sick also. And that's one of the things that could overwhelm the system.
We're told contact tracing, PPE, more testing, and protecting the most vulnerable also need to still be part of the plans. We do know the state has the option for more beds at St. Luke's. However, it's unclear what the trigger point is to activate that hospital. We're told that the state is looking at hospital data across the area and tracking it. In Phoenix, Nicole Grigg, ABC 15, Arizona.